advocacy period, where what IBM has done with this transition is they've given you an ongoing advocate in your corner. That's us, One Exchange. So we are here for you 65 hours a week. You can call as often as you want, never a fee to you for our service, and we are really objective. We want to just help you find the right plan, the right circumstances for your health and drug needs. Okay? That enrollment guide and that dedicated IBM number, so just to write it down again, it's 1-855-359-7380. That's a dedicated IBM retiree line, so please don't give that to anybody else. What that does is part of our state-of-the-art call technology is the minute you dial that and it rings, we know, okay, it's an IBM retiree calling. And then it asks you for your 5-digit zip code. The minute you punch that in, it says, okay, it's an IBM retiree in the state of Florida calling. I need to route you to a licensed benefit advisor for the state of Florida. Helps save you wait time so that you're not waiting on the phone and then getting a voice and saying, oh, I'm from Florida. Oh, let me find you someone. Our technology already does that for you. Okay, that's why it's important for you to keep that number to yourself. The website, medicare.oneexchange.com/IBM. How many people go to that website regularly? All right, a couple of people. So that's got fun information, useful resources. It actually works. We have a prescription profiler on there where you can go analyze your prescription drug costs if you wanted to. It's also got a Help Me Choose comparison tool where it'll help you see what different plans are available. It tells you the premiums. It gives you all the summary of benefit information for them. It even ranks them in order of least out-of-pocket expense. So it's a great comparison tool, and it's available 24/7. What I will also add is that there's never a need to do this because we always have live benefit advisors, live customer service representatives available, and we're happy to do all the work for you, but we just want you to know that it is there in case you would like to do it, okay? So everything is available on the website. So I'll go over with you all the resources, okay? And do me a favor, please keep questions for the question and answer session. Benefit advisors, let me just review again why this is such an important component of our service, okay? Our benefit advisors are licensed, certified, and appointed. It's a very rigorous process. They first start off, they have to become licensed health insurance agents through the Department of Insurance, okay? Go through the standard state Department of Insurance background security checks, pass the exam, everything, before they're even considered for employment. Then they go through our One Exchange University, which is accredited by the state's Department of Insurance. It's a 6-week program teaching about Medicare, about compliance, about how to probe for health care needs, about how to take the needs that a retiree gives them and then how to recommend plans. Okay, once they pass the One Exchange University exams with at least an 85 or better, then they're eligible to be certified with the different carriers that they're going to represent. Okay, every single carrier they represent has carrier certifications that they also must pass with an 85 or better. And then once they do that, then the insurance carriers say, yes, I appoint you to represent my products, my plans in the states that you're going to represent. Very rigorous process. Not everybody who starts completes. But everybody you talk to who is a benefit advisor for us has gone through that entire process. Objective and unbiased, neutral compensation. So hopefully you remember from last year, I also mentioned this. No commissions. They're just paid a salary wage, anyone on the phone you talk to. So there is no incentive for them to recommend one plan over another, one carrier over another, other than wanting to satisfy the needs that you're going to tell them you have over the phone, and other than wanting to save you money, okay? Once again, they can't help but save you money because just similarly, they have a tool that's not as cosmetically appealing as this. They have a different tool, but it's the same server. Their tool, as they're talking to you and hearing what your needs are, they're punching in information while holding conversation, and it's going to rank the results in least out-of-pocket expense order. So they're just going to go to the top few. They can't help but try and save you money. Okay, so, and 100% domestic workforce. Benefit advisors can discuss coverage options with anyone. So that's one thing that I know some retirees say, you know what, I don't really like to talk on the phone. Or you know what, next year's healthcare decisions is really important. I want to get my son John or my daughter Jane involved in the decision, right? No worries, you just have to call in once and let us know, hey, I want to add John onto my profile of someone I'm authorizing to call in to talk to you about my healthcare needs. We'll act on your authorization and add that to the profile, and then the next time John can just call in. We care about the privacy of your information, so we'll do something called a secure the call. So we'll ask for your last four of your social, your telephone number, your date of birth, that kind of stuff. But as long as John can answer those secure the call questions, then John can ask away. He can just call by himself, and he can call and ask in your place, okay? The one thing I want to mention about enrollment, right? By law, CMS requires that at the time of enrollment, it must be you, the participant, who does the enrolling, who's on the phone, or someone known as a durable power of attorney, a durable POA. Okay, that's someone who's legally authorized to make healthcare enrollment decisions for you. So that's just the heads up that if that's something you think you're going to need, you'll want to have that legal documentation ready. At the time of enrollment, we'll take your word that you have legal durable POA. The carriers are required by law when they process your enrollment to obtain proof of durable POA from you. Okay? Our telephonic enrollment is in two parts. We've found through our 9 years that what's most efficient is to start off having licensed benefit advisors who are the specialists in figuring out healthcare needs and recommending solutions. And then when you're comfortable moving forward with enrollment, passing the baton over to an application data processor. They're the specialists in filling out that online application, dotting the I's, crossing the T's, knowing how a carrier wants an application to be filled out. Right? Some carriers are pretty finicky. We have carriers who want one question answered with a yes, and another carrier wants a similar question answered with a no. And they're trained to understand that to optimize first-time acceptance of the application. So the ADPs will do that and process your application. And then 100% of calls are recorded for your protection, okay? We save calls, the audio files, for over 7 years. That's a selection confirmation notice. So I want you to all feel comfortable. Just because we say it's 100% paperless enrollment, which is to your benefit, that doesn't mean there's no audit trails, okay? You'll get a selection confirmation notice sent to you in the postal mail, so you'll see, oh yes, that's what I enrolled in, that's what I enrolled in, that's what I enrolled in. 24/7 after enrollment, you can go online and print off information about what you enrolled in. And then the carriers, so as a third audit trail, the carriers are required by CMS to send you a detailed explanation of benefits of what you enrolled in, along with your new member kit, your ID cards, all those kinds of things. So there's definitely audit trails to go along with the paperless enrollment. So they're reviewing the HRA, right? So the HRA is that tax-free account used to reimburse you for eligible healthcare expenses, right? And this is an IRS instrument, and so the way IRS set it up is the R is important, reimbursement. So you always have to pay your premiums first, and then you get reimbursed with available HRA dollars, right? So IBM's making an annual contribution into the HRA, and you can reimburse yourself for eligible medical, prescription drug, dental, vision premiums, including that Medicare Part B premiums if you wanted, as well as eligible out-of-pocket healthcare expenses. right? So your annual contribution becomes available January 1st of every year. So your 2015 one will become available January 1st, 2015. And the thing to know is that unused funds do not roll over. So it's best just to use it up. So Dr. Ree, the healthcare director for IBM, he just wanted you to be able to use the full extent of the funds because they're going to continue it every year anyway. So just go ahead and use it. Anything that you have remaining in the 2014, you have 6 months into the next year to file reimbursement forms for that. So you have till the end of June if you want for the 2014 funds, okay? Visually, how it's just represented is that you will always pay first the premiums directly to the insurance carrier that you choose. So your relationship is direct to them. And I know many of you say you set up automatic deduction out of a bank account for your monthly premiums. So that always happens directly with the insurance company. And then somehow one exchange gets notification either by you filing a manual form to us or through automatic reimbursement that you've paid those premiums. We are administering the HRA for you and for IBM. And then out of available dollars, we reimburse you, okay? And what most retirees also do is say, hey, just automatically deposit that back into my bank account as well, too. So those are the two ways to get reimbursed, automatic and manual, right? Most people are used to the manual, which is just direct between you and insurance carrier, and then direct between you and one exchange. You're in total control. It's ad hoc. Whenever you want to fill out a manual reimbursement form, you can just do that, attach documentation, make sure you sign it. Many retirees forget to sign the form. And then we get it and process it very fast, right? The automatic reimbursement is less labor intensive. It's a triangular relationship. So you pay the insurance carrier first. The insurance carrier sends one exchange a computer file telling us that you've paid, and then we reimburse you out of available dollars from your HRA account. Okay. Personal guidance. So really, anything, hopefully you've had a year to kind of get comfortable with this, but hopefully you will get comfortable with knowing that you have now a healthcare advocate in your corner. Anytime you have any questions about, how do I navigate the website? Do I have prescription drug changes, right? I have questions about my HRA, or maybe I just want to do an annual plan review, right? So those of you, so this box is important. The plans you select continue on year to year. No need to re-enroll in the fall unless you want to make a plan change. So it's not required that you do so, but we always recommend, it doesn't hurt to do a plan review change, right? Because sometimes carriers raise premiums. Sometimes other carriers lower premiums because they want to be competitive, right? The beauty of this, why IBM and other employers, right? So this year, we've transitioned GE retirees. We've transitioned General Dynamics retirees. We've transitioned PepsiCo retirees. We've transitioned Northrop Grumman retirees. The list just goes on and on and on. Why all these employers are doing this is because they can't compete against the Medicare marketplace, right? Even a company like IBM, where give or take about 130,000 retirees, 130,000, 50 million Medicare people can't compete. Medicare currently, there's 50 million people, growing by 2030 to 70 million people. That's a huge target market for insurance carriers to want to go after, right? You just can't compete, even as large as 130,000 retirees, 50 million. So the insurance carriers are always, every year, saying, how do I get that business? So maybe one year, one carrier's rates were really, really good, but the next year, this carrier Y says, hey, I want that action instead. I'm going to undercut them with a lower premium. That's always happening in the Medicare marketplace, and that's why we're here to help you figure that out. So an annual plan review is always useful. At a minimum, they'll say, hey, you know what? You still got the most effective plans. Just stay with it. And then you can hang up and enjoy your holidays knowing, hey, I had a licensed benefit advisor tell me I've still got the most effective plans. Happy holidays, right? Or you can have them say, hey, you know what? I've got this plan Z here that's actually got a lower premium, right? And then look at the implications. Is it guaranteed issue? Oh, it's not guaranteed issue, so maybe you don't want to change. But they can do the annual plan review for you. So I always recommend call in, make an appointment, do an annual plan review. It's free. Why not use it? Localized slides. So I wanted to share with you some information because I wanted you to see what's happening for the 2015 year right here. So I use zip code 33486, Palm Beach County. So for 2015, you have 19 Medicare Advantage plans available for you. You have 15 Medigap plans, so 19 ranging from a low of $0 a month, so can't beat that, to $127 a month premium. 15 Medigap plans ranging from a low of $136 a month to $447. And 20 prescription drug plans available for you ranging from a low of $16 a month to $172. And by the way, you see there the different carriers that we represent. Oh, so for the sake of it being videotaped, so for Medicare Advantage, AARP, UHC, Aetna, Humana, Coventry, Florida Blue, WellCare. For Medigap's carriers, AARP, United Health Care, Florida Blue, Humana. And for prescription drug carriers, AARP, United Health Care, Aetna, Cigna, Coventry, Express Scripts, Florida Blue, Humana, Silver Script, WellCare. So once again, this is all available to you at the website or just by calling in. Your benefit advisors will know all this, okay? So if you add this up, right, 54 plans are available for you for the 2015 year. Right. There is no Aetna under Medigap. So for the Aetna, right, so the Aetna folks that were on the grandfathered Aetna plan, you have one more year if you would like to. So last year you could have stayed on the Aetna HMO or PPO plan. This year, for one more year, you may do so one more time. And if you do that, you won't get the HRA, but you'll get a separate IBM subsidy. But for sure, your Aetna group plan will terminate at the end of 2015, and you will have to transition over next year if you don't do so this year, okay? So you all, when you decide to make the transition, you will have that special election period since you didn't execute it yet, and you will have guaranteed issue. Okay, let's hang on to the questions for the question and answer session, please. So 54 plans, right? So this is the answer to the question of, can you send me plans? Who wants to read 54 plans? Who would read, honestly, 54 plans? No. That's why we have benefit advisors who do the work for you. They're going to end up learning what your needs are, and then just going to recommend the top 1 or 2 or 3 plans that fit your needs so that you don't have to worry about the other 50. Doesn't that make more sense? To have someone do the work for you, right? So that's why we don't send out plans, because you wouldn't read them if we did. Vision and dental, they're not Medicare plans, but they're ancillary coverage, so you can ask us about the ones we represent, or you're welcome to look at them on your own. Or if you go Medicare Advantage, the vision and dental will be bundled in. But we do represent one vision plan. It's the vision service plan. It's got a $150 annual premium. Vision plans are always annual in nature. Dental, we represent Delta Dental, Humana, and MetLife Dental, ranging from a $13 a month to $47 a month premium. And I mentioned here, they're not Medicare plans. Okay, so now I want to show you some bookend representative plan examples with rates. Here's a Medicare Advantage plan, right? So on the low premium end, it's got a $0 a month premium, but it's an HMO. So it's a restricted network-based plan. The deductible and the doctor copay are not bad at $0, but it's got a $35 per visit specialist copay. Days 1 to 8, the hospital copay is $90 per day. And the emergency room is a $65 per visit copay. Okay, so those are the pay-as-you-go features of the Medicare Advantage plan. It's got bundled in prescription drug coverage. The deductible is only $0, so that's not bad. And then the copay tiers in this case are 0, 10, 25, 60, 33%. And you say, Bill, what does that mean? Right? So drug plans, the drug plan carriers, they're allowed to put their formulary, just fancy name for drug list, into different tiers. Right? Tier 1 will always be your preferred generic drugs. Tier 2 will be your non-preferred generic drugs. Tier 3 will be your preferred brand name drugs, in this case, $25 copay. Tier 4 will be your non-preferred brand name drugs. And then Tier 5 will be your specialty drugs, typically your most expensive drugs, and typically a co-insurance percentage rather than a copay amount. And that's for a 30-day supply at a preferred retail pharmacy. And then this particular plan does offer mail order pharmacy, and you typically can save some money there for a 90-day supply if you're willing to have it sent to your home. And in this case, representative case, it's just 0, 25, 63, 150. Okay, so that's an example of a Medicare Advantage plan for 2015. Going to the other end of the spectrum, here's an example of a Medigap Plan F for 2015, right? So here I picked a Plan F. So F is in full, right? Full coverage. The medical is $328. And then as you see, there's no network, right? Because for Medigap, it's the entire United States, any doctor, any hospital in the United States that accepts Medicare, okay? No deductible, no copay, no specialist, no hospital, no emergency room. Again, the Medigap Plan F is a pay up front. As long as you pay that monthly premium, you're done, okay? Interesting educational observation I want to share with you. Did you notice that here, the Medigap range was 136 to 447, right? So the 447 must be a Plan F, right? Because the Plan F is the most comprehensive, right? So it would be the most expensive. But yet, I found a Plan F that was only $328. How big a difference? Lesson there is an F is an F is an F. A G is a G is a G. An N is an N is an N. If you decide that you want to go Medigap path and you pick a particular letter, just go with the plan that's got the lowest premium. Don't care about the carrier brand, because all Medigaps are just financial insurance, right? They offer the same benefits as regulated by CMS. So why would you want to pay $447 for a Plan F a month when you can get a Plan F for $328? Who wants to pay the $447? Right? Does that make sense? Is that a good educational encouragement there? So if you go the Medigap route, whatever letter you pick, just go with the letter that has the lowest premium. It's just financial insurance. You're going to get the same coverage. Whatever original Medicare doesn't pay, the F is going to cover financially. You're seeing any doctor, any hospital you want nationwide that accepts Medicare. Does that make sense? That's really, really important there, okay? That's not the case for prescription drug plans, and I'm going to tell you about that in just a second. So here, remember, Medigaps never come with prescription drug coverage, right? So I'm going to add on a standalone drug plan. So I found one that's $21 a month. So your total premiums, if you go this route, is a $349, okay? Because you have to have a Medigap for your medical, and then you have to add on if you want prescription drug coverage. The prescription drug plan is pretty nice. It comes with a $0 deductible, So I wanted to kind of match it with that Medicare Advantage plan I just showed you. And it's got copay tiers of 8, 8, 40, 42%, 33%, and it also does have mail order also. So here though, we just said for gaps, just take the lowest premium, right? But for prescription drugs, some of you would say, well, I'm just gonna go with the $16. No, why? Because in terms of drug plans, isn't there one other component besides the premium? Exactly, right? He said copays for the drugs, right? So your most effective drug plan is going to be the one that's got premiums times 12 plus the least out-of-pocket expense you're going to have for the drugs that you need. Does that make sense? So the lesson there is when you're picking drug plans, don't necessarily just pick the one that's got the lowest monthly premium, right? So gaps do pick the letter that's got the lowest monthly premium. Drugs don't necessarily. Let us do the analysis for you, right? Does anybody here have the same exact drug needs as anybody else? No. Not even in a couple, Mr. and Mrs. Smith, would they have the same exact drug needs, right? So where we want to do it, put us to work. My benefit advisors are intensely trained on how to analyze drug copays. So let us do the work for you, and we'll help you to know what plan is going to be the most effective, least out-of-pocket total expense, okay? So to drive that home, it's very possible for a $16 a month premium drug plan to have copays for the drugs that you need that are really, really high versus, and I'm just making this number up, a $69 a month premium drug plan whose copays for those same drugs that you need to be really, really low, so that the total out-of-pocket expense is actually lower and better with the $69 a month premium plan than the $16 a month premium plan. Does that make sense? We don't know, so let the benefit advisor do that analysis for you, okay? I want to just show you here as an interesting thing, because since I've been here 2 years now. Last year when we did the meetings at the Marriott Boca Center, it was the month of September, so the rates for 2014 hadn't come out yet because CMS doesn't release the rates until the month of October. So I actually shared with you 2013 rates. That was the chart I showed. And this is the chart I just showed you. So if you notice, from 2013 to 2015, if you had gone a Medigap Plan F with the PDP, you actually would go down by $4. Just giving you, because I know you guys like to see some of these information, what happened year to year, that kind of stuff. So it all depends, right? It helps to do an annual plan review. Okay. This is a very busy prescription drug coverage slide for Medicare prescription drug coverage, right? Once again, I mentioned nobody here has the exact same drug needs. So the time to go in depth into this chart is when you have a couple-on-one enrollment consultation, and then the benefit advisor will go over in depth with you. Okay, Mr. Smith, you enter the coverage gap in August. Oh, Mrs. Smith, no, you don't enter the coverage gap at all, those kind of things, and they will do that. At a high level here, with so many people here, I just want to share that there's 4 different potential levels of prescription drug coverage. Some plans have a deductible, so that's the first level. It can, for 2015, it can be anywhere from 0 to 320. So that just means if there is a deductible, the first dollars are out of your pocket. Then you enter that initial coverage level, and that's where those tiers of copays come into play. That's what you pay per drug, right? And then some of you may enter a coverage gap, which is also known as a donut hole. But the fun fact about that is only 25% of Medicare recipients ever reach the donut hole. So 75% of you won't have to worry about that. And then the last level is the catastrophic coverage. that's when the price of drugs actually drops again. The reason why they call it the nickname donut hole is because in the donut hole, you're paying a lot more than you would on either side of that level, okay? Catastrophic coverage here, unfortunately, just means you're really, really sick, and so you pay a lot less for your drugs. But the fun fact about this is only 4% reach catastrophic, so 96% of you won't have to worry about the catastrophic coverage level. So once again, I just want to go through this very fast. I don't want to information overload you. When you do your one-on-one or couple-on-one, they will go through this in-depth based upon the specific drugs that you have, okay? The next steps, once again, we encourage you to call that number, right? If you do want to make a change, especially on the Medicare Advantage side, you need to do that. Last day is December 7th, okay? You don't have until the end of the month, end of December, end of the year. You have to do it by December 7th. So it's not too early to call in and schedule an appointment right now, those kind of things, okay? It's also never too early just to call in for an annual review, even if you think you're gonna make no change, right? It doesn't hurt to do a plan review. And then those of you who are currently on the Aetna, if you want to transition over, you actually have until the end of the year, and you would be granted a special election period for guaranteed issue because this is the first time you're coming over. But again, I would encourage you to call in. Don't wait till December 26th to make the appointment and that kind of stuff, right? So always when you call in, it helps if you have your red, white, and blue Medicare card handy because we want to verify and make sure all the information we have in our system is exactly identical to how it appears on your Medicare card. Otherwise, it'll mess up the application, okay? So, and also helps to just have your pill bottles in front of you too. Why do I say that? Because I mean, a lot of you know your prescriptions, right? But there's thousands of prescriptions, some that just differ by a letter, right? We want to make sure we're analyzing the right prescription, the right dosage, the right frequency, so that we don't quote you a wrong figure, that kind of stuff. So it's just easier to have the bottles in front of you. Here is a snapshot of the welcome screen of the IBM page, right? The Medicare.oneexchange.com/IBM. If you haven't gone to the website, and so there weren't a lot of hands that raised, you're missing a lot of information. Looking at videos, looking about information about this year's open enrollment period, downloading 2014 FAQs, downloading 2015 FAQs, the IBM Couples HRA Survivor Election Q&A, 2014 Prescription Profiler, the Medicare Exchange newsletter. How many people knew that we actually publish a newsletter? No? Okay. The enrollment guide, this year's enrollment guide, how the HRA works. If you wanted to see Dr. Ree's video from last year, it's all there 24/7. That's why a lot of us, you know, my team and I, we always scratch our heads when we say, can I get this as a handout? It's all there. Everything we present to you is already here on the website. You're just asking for it in a different format. But it's all there 24/7. It's been there all the time for you. You just have to go look at it. So that's why we don't have handouts. Okay, that's the reason why, because it's already there for you. All right, so I went through a lot faster than I normally do because, again, you guys are kind of repeats, right? So I want to kind of take questions. If you have question cards, do you want to do the question cards, or you just want to do raise your hand and ask questions? Just raise hands. All right, so then I'll go left and right, and then I actually have another mic, so we'll turn that other mic on. Let's get test. Okay. Testing, 1, 2, 3. All right, so we'll take one from each side. So I saw your hand up first, ma'am. So because they're recording this, I'll ask you to speak it into the mic.
Hello, I'm Alice. I just want to ask, is the HRA taxable? And do we have to report it on our taxes?
Okay, good question. So everybody heard that, right? Okay, so the HRA is not, right? So the beauty of the HRA and why IBM set it up as HRA, because it's a tax-free account. Okay, but the requirement there to make it tax-free is that you pay first and then you get reimbursed out of eligible funds. I saw your hand, sir. Pardon me, if you could pass that on. Oh, thank you. Yep.
If you were enrolled in the
Sure.
reimbursement this year, if you were already enrolled and you got reimbursements for this year, will it automatically give you the reimbursement for next year?
Okay, good question. So if you received your HRA, you will automatically get another 2015 HRA, okay? But the thing, just to remind everybody, for IBM, so this differs for every different employer client. The employer client decides this. IBM's HRAs do not roll over. So you definitely want to use up your 2014 funds, and you have 6 months into the next year to use it up, and then you get a new allotment on January 1st of 2015. Let me go side to side. All right, Cole, you go. All right, go for it, and then I'll come back here. Go ahead. Yes.
I'd like to know if there's a cap on these plans in the form of annual increases, 3%, 5%.
In terms of the
Plans for
premiums, you mean?
future, and it's hard to do without knowing what the increases might be.
Got it. Okay, so plans are allowed to increase their premiums, and what we typically find is across the board, there's probably about a 3 to 4% national average of premium increase. So it's entirely up to the plans themselves, though. Like I said, I've also seen carriers, because they want to compete in the market, I've seen them reduce their premiums too, because that other carrier was getting all the business and they were sick of it, and so they reduced their premiums. But plans are allowed to increase their premiums. They have to let you as a member know, by law, they have to give you at least a 60-day notice, written notice, that they're going to increase their premiums. And so what we always recommend is, if you see an increase to a plan that you're enrolled in that's too high, like typically over 10%, call in and talk to us. And then we're happy to tell you what alternatives you have. Okay. Let's come over here with one. Yes, sir.
I'm Wolfgang Kirpius. There are two questions related to each other.
Yep.
The first one is, can you help us with getting to the unresponsiveness of Humana?
Okay.
Because I tell you, we had some, I mean, they're unresponsive.
Okay, so the answer is One Exchange can definitely help you. And so you would want to call into the service center and get the concern logged. And so we log every single call. And for sure, we have other access to Humana, right? We're not just calling their customer service department.
You guys did not encourage us to do this. I mean, they said it's out of our hands.
Well, so two things, right? So two things I want to make. We do want you to give the carrier, because again, everybody you're talking about, like a Humana, they're national carriers. They have reputations at stake, right? We have a chance good customer service. But if you're not feeling that, absolutely get us involved. We are happy to be involved with you in claims adjudication, in customer service concerns, and we absolutely have better access. We're not just calling their customer service department. So
okay, and if this is the case, if you want to change in 2015 from Humana or company A to company B within Medigap.
Medigap, okay.
Medigap, is there still the guaranteed issue? In other words, do you fall into this other, that all of a sudden your preconditions are important?
The answer is yes. So unless there is a special circumstance, you, on the Medigap side, you are always susceptible to medical underwriting, which is questions about pre-existing medical conditions.
Which means you have to stay with the same company, really. I don't know if you understood. I mean, if you go from Humana to Blue Cross or whatever the number might be, are you then subject to
right, unless you have a special circumstance. So again, we list the special circumstance could be moving out of state, could be marital status change, could be some other circumstance, but that's just the law. That's not our rule. That's the government law. Let's come back to this side if we would. How about that lady back there? Yes.
I have two related questions. Are drug costs locked in for the year? And do all Medigap plans cover the same drugs?
Yes and no. So our drug costs, well, so once again, private drug companies are allowed to raise their rates, but they have to give you at least a 60-day notice. So given that there's less than 60 days, they are locked in for the rest of this year. But they could make it, for example, they could send you tomorrow a notice that they're going to raise their rates in February, 60 days notice. Okay, so they could do that. And then your second question was? Do all Medigap plans cover the same drugs? No. So all drug companies can put together whatever formulary, fancy word for drug list, they want. They can actually even put a particular drug in whatever tier they want. So I'll give you an example. When Lipitor lost its proprietary license, some drug companies put it into a drug tier 1. Other drug companies put the generic version of atorvastatin into tier 1 and put Lipitor actually into a higher copay tier, tier 3. Okay, so drug companies can set whatever prices they want. Sure, whatever.
I'm Diane. I kept the IBM plan this year with Aetna, the
Okay.
PPO. And during the year, I got messages from Boca Hospital and from one doctor saying that they did not reach agreement with Aetna. So that, one suggested I find another insurance company. Is that the problem with the PPOs as opposed to Medigap? Would that not happen? If I had Medigap, I would not have to worry about it? Or a supplemental?
So the way I need to answer that is it would happen less, because when you're on the Medigap side, it's any doctor or any hospital across the nation that accepts Medicare, right?
Right.
Whereas on the Medicare Advantage side, the PPO, the Aetna side, they're private networks. They can do whatever they want because they're a private health plan, okay? But so what I would suggest you do is you probably want to think about whether you want to transition now for the 2015 year and activate your special election period, get guaranteed issue, or whether you want to try and use it for one more year, but for sure it's going to end at the end of 2015. So you actually have a choice of both, okay? You could transition over now, or you can transition over a year from now. But I would definitely just call and make an appointment, and we'll talk to you about it, okay? Yes, sir. Let's have, we'll use the mic since we're recording this, so.
How do I initiate,
Yeah.
how do I initiate this HRA? Where do I get the forms? How do I start it? And how do I start the automatic program?
So help me to know, sir, currently, what are you on? Have you made the transition over yet?
No, I've been on Humana the past year.
You've been on Humana the past year, the
PPO.
PPO, but you transitioned last year from the
Yes.
IBM.
Yes.
Okay, so you're already over. So you were getting an HRA. So the requirement is that you enroll in a medical or prescription drug plan through one exchange that activates and makes you eligible for your HRA. So as long as did you do that through us last year?
Yes.
Okay, so you got the HRA.
Yes.
Yes.
And
And you'll get one in January 1st.
do I get a form or something to fill
No
out?
need. You automatically get it.
Oh, I see. Okay. Thank you.
Yeah. We like to save you work.
He needs a form.
Oh, to get reimbursement. He asked, how do you get the HRA? To get reimbursed. So did you select automatic reimbursement?
I don't know.
So what I would do is call in and ask, did I pick automatic reimbursement last year? They'll tell you yes or no. If it's yes, you would automatically get reimbursed. If no, then you just file manual forms whenever you want to.
And where do I get the form?
And they can help you to do that over the phone.
Okay. Thank you.
So once again, everyone, all the action takes place at the service center. Okay, so what I want to leave here today with, don't be afraid to call into the service center. They're not going to bite you. They're there to help you. All the action takes place at the service center.
Thank you, Bob. Two quick questions. One, I noticed on the Part D, you have one of those coverages at $16. Is that the one I'm presently on Humana paying $12.64?
It could be a different plan. I'm sharing with you 2015 plans, rates.
There, see the $16?
Right.
Is that the one I'm presently paying $12.64?
I have no idea because they're different
Okay.
plans.
Second question, and this is much more important, I believe.
Yeah.
The HRA, is it going to remain exactly the same as it was in 2014? Increase or decrease or zero?
As far as I know, it's going to be exact same. IBM
you,
has
sir.
not said anything else. Yes.
Thank you. Do we use, in the past, we've had the Aclaris form for the Medicare Part B reimbursement. Do we use that again, or do we use the IBM reimbursement form through the Towers Exchange?
To get reimbursed for your Medicare Part B?
Yes.
It'll be a one exchange form, so just call in and
Thank you. Right.
right, that has nothing to do with right, I have nothing to do with SHAP. Right, I have nothing to do with SHAP. SHAP remains unchanged.
Okay.
So thank you. I have
So
nothing to do with
in
SHAP.
addition.
If you are not having SHAP and you want to get reimbursed for your Part B, you would work through us. If you have SHAP, you're still on SHAP.
Okay, thank you.
Yes.
And the next question is, if you should need an operation on your eyes, would that go through vision or would that go through medical?
It depends. You would want to talk to, one, the benefit advisor, and two, your doctor
Okay,
about
right.
the specifics about that.
thank you.
Yeah. Yep. Let's go over this side.
My name's Jim. Two questions.
Yep.
On the HRA, when you sign up for premium for a Medigap, you have to pay right then. As it turns out, that's usually the year before. So how do you retrieve that premium during the year? For me, I did it last year. It was $268. And I tried to get it the next year and they turned it down. They didn't.
No, you would probably just have to let them know you paid that first ones up front, but you are paying for your January premium for
Yeah, I
sure. So as
understand.
long as you can prove that, you're eligible, absolutely.
So-
They may have just been a miscommunication, but absolutely, you
Yeah,
can
'cause
get
they
that
just turned
back.
it down.
Yeah, no, you would want to go back in and just say, hey, I was paying upfront for my January premium. Just clarify that with them. And they'll
Okay,
take care of
second
that for you.
question. I just want to make sure that I understand what you told the other gentleman. If you are already on the automatic pay for the HRA, for your Medigap, is it automatically reinstated in the next year, or do you have to instate it? You have to put it in.
The HRA allocation is an automatic.
That's what I
So
mean.
if you got it for this year, you will get it for 2015. That is an automatic. Yes,
Okay, thank you.
yes. Just want to make sure that we understand that's different from getting reimbursed the premiums, right? Which may or may not be automatic. Right? So again, right. So I want to just make sure everybody understands. The HRA allocation by IBM, of which we're administering, is an automatic every January 1st. The reimbursement of premiums you pay will either be automatic if you've selected automatic reimbursement, or if you have not, they're manual. Which was automatic? The premium reimbursement?
The premium reimbursement.
Right,
That's
so
what I'm
if your
talking about.
premium reimbursement was automatic, you will still continue to have automatic reimbursement unless the carrier decides to no longer offer automatic reimbursement.
Okay.
Yes, yes.
You've used the expression out of available dollars.
Yes.
Could you explain that to me a little more clearly?
Sure. So I'm just making numbers up, right? If your HRA was 500 and your premium was 600, you only have 500 that you can get reimbursed. We're not going to reimburse you 600. So that's what that just means. Just out of available dollars, right? So, because again, you can be reimbursed for lots of things, right? You can be reimbursed for your Medicare Part B 104.90. You can be reimbursed for your drug out-of-pocket expenses. You can be reimbursed for your drug premiums, your vision premiums, your dental premiums. If that all adds up to more than your HRA, then you wouldn't be reimbursed anything over that amount. Yes, sir.
Bill, I got this form in the mail from One Exchange,
Okay.
all right?
Let me take that.
And it says for me not to send it in until I get information from Social Security.
Okay.
I've been waiting for 2 months now, and I haven't gotten anything from Social Security. How long do I wait, and when does this run out? And what do I, what do I do?
That's the tough thing, that even we have no control over Social Security Administration. So my recommendation, call Social Security Administration, say, you're waiting for something from you for us to be able to process this.
I don't know what I'm waiting for.
Well, what he's
You know,
wanting to
I-
do is he wants to fill out a recurring Medicare Part B reimbursement.
I don't know what, it
So-
came in the mail. I did not request anything.
Oh, okay,
It
so
came
you
through
can
the
decide
outer
whether
door.
you want to or not. What this form is saying is that you want to, without having to fill out paperwork every month, to, on a monthly basis, be reimbursed your 104.90 that you're currently getting automatically deducted out of your Social Security check.
That's SHAP. Isn't that the old SHAP?
Well, if you have SHAP, then you don't need this. So again, One Exchange has nothing to do with SHAP. That's a totally separate program. Some people don't have SHAP, okay? So the thing to remember, guys, there's 72 different IBM population segments across the country, okay? So don't just assume that what you have, everybody else has. It depends, okay? So we don't know. Some people have SHAP, some people don't have SHAP. If you have SHAP and that's what you're getting reimbursed your Part B from, stay with that. Then you don't
Well,
need
I
this.
used to, but I don't think I got anything this year because I thought it was being covered by
So again,
extended.
we have nothing to do with SHAP. So you want to talk to the IBM Benefits Center to ask them.
That was never made clear.
Okay,
That
right.
was never made clear.
We have nothing to do with SHAP. SHAP is still IBM. If you don't have SHAP and you have an HRA and you have available HRA dollars and you would like to get reimbursed for that Part B 104.90 that's currently automatically deducted out of your Social Security check, you may do so, and you can even fill out this recurring form so that you just fill it out once a year. You don't have to fill out 12 times a year. But that's if you don't have SHAP and you want to be reimbursed for your Part B premiums, okay?
Bill,
SHAP is, talk to IBM. I have nothing to do with SHAP. I
Is this
can't
on?
represent SHAP.
I have a comment about that. I called One Exchange and asked how I get reimbursed for my Medicare, and I wish mine was only 104.90. But they told me I needed the award letter that you get from Social Security every year that tells you how much you're going to pay. I didn't have it. I signed on to the Social Security site, and you can get it printed there.
Yeah.
Just a FYI.
Yeah, we have nothing to do with Social Security Administration, so. The 104.90, you're gonna probably have to fill out once a year because the amount may change, even though for 2015 it's not changing. Okay, next question. Let's come back over to that side over there here. Thank you.
If you currently have a Medigap supplement with Blue Cross, let's say, can they reject you next year for an existing condition?
Great question, and the answer is no. Once you're in, you're guaranteed renewable. So as long as you stay with the Plan F, for example, they will never ask questions about pre-existing medical conditions. You're always guaranteed renewable. That's the same for Medigap or Medicare Advantage.
On the Medigap Plan F, is that the PPO?
No, Medigap Plan F is a Medigap plan, so you're on the Medicare supplement side. PPO is always Medicare Advantage path, two different paths.
So you have to have your doctor recommending you then to a specialist.
No. So on a PPO, even though you're Medicare Advantage path, PPO, remember the one word is freedom, right? HMO, the one word is restrictive. PPO, the one word is freedom. Medicare Advantage side is both. PPO, freedom to see any doctor I want. I don't need to have a primary care physician approval first. But that's all Medicare Advantage side.
Not Medigap at all.
Not Medigap at all.
Okay, just one simple clarification. If you have SHAP, then you don't need the HRA. Is that it?
No. SHAP has nothing to do with HRAs.
Okay, so.
You can have an HRA and have SHAP too.
Okay.
From my understanding, SHAP has to do with Medicare Part B reimbursement, but I don't represent SHAP. So I'm legally not allowed to talk about SHAP.
Okay.
But it has nothing to do with HRA.
The IBM contribution to the HRA, that stays the same, $3,500.
As far as we've been told, yeah. So what you get depends upon your circumstance, right? Of whether you pick the spousal thing or not, or so again, 72 different population segments could have a different HRA. So
Okay.
I don't know what your HRA is.
Second question, if you spent 3 months of the year in another state, pretty clearly you should have a Medigap.
I would.
Yeah.
Because a Medigap is any doctor, any hospital that accepts Medicare nationwide.
Now, that's not guaranteed issue. However, you can renew it year to year if you want to keep it. So if you suddenly came down with a catastrophic illness, they couldn't drop you on the next renewal, correct?
That's correct. You're guaranteed renewable. Now, again, once again, I would recommend if you have considerations like what's the other state other than Florida? I would have a talk. So again, advantage is network-based, right? But the private health plans are getting quite creative in their network. For example, there are health plans whose networks, because we know there are snowbirds, are New York and Florida, but nothing in between. So talk to a benefit advisor. They'll look and see, is there a Medicare Advantage plan that has as its network Massachusetts and Florida? I don't know. There may be, right? Again, the private health plans are getting quite creative because, again, they want to go after the 50 million Medicare recipients and how they're carving out their service areas. And because they know there are so many snowbirds.
I have a question about the HRA reimbursement.
Yes.
If I recall correctly, last year when it was presented, there were two choices, as you described today. The automatic online,
Yes.
longer to receive your reimbursement than if you did it hard copy through the mail. Does that still exist?
So great question. Thank you for asking that. So I kind of flew through that because I figured most of you remembered it from last year, but let me spend some time. So the one thing about automatic reimbursement is that initially to get first set up on automatic reimbursement, there can be a 2 to 3 billing cycle lag time. That's just initially up front because it depends upon when you activate automatic reimbursement, when the carrier sends us the computer file, when you pay your premiums, all those kinds of things, so that we have to say it may take, not saying indefinite will, but just depending on the timing, it may take 2 to 3 billing cycles. Once you get set up, it works like clockwork, just about the same date every month. You can have it automatically deposited into your checking account. But just the initial setup could take 2 to 3 billing cycles. Thanks for asking.
Bill, I asked this question before, and I think I got a different answer than you just gave. If you're on Plan F with a company, and because of the company, you want to switch to a different company, but stay with the same plan, do you or do you not have the guaranteed issue
Right, same answer. Yes, you are, unless you have a special circumstance.
So in other words, it does not pay to go from company to company.
Not if pre-existing medical conditions is a concern. Not everybody has pre-existing medical conditions, right? So once again, everybody's different, right? So he's got the mic, so wherever he goes. Yes, sir, all the way in the back.
Okay, thank you. There's two things that jumped out at me that I haven't really resolved in my mind. And one is you're talking about when you get a tier 3 or tier 4 drug.
Yes.
It's very expensive, right? So just for the sake of argument, you go in and you renew your drugs and it costs you $400 out of pocket. And the insurance paid $1,100 for the same drug, okay? Now that copay is not reimbursable, is that correct?
No, that is reimbursable. So you can get reimbursed for out-of-pocket drug expenses if you want to, and you have available HRA dollars.
Okay, so then you just put that in through a reclaim and then,
So that would be one, because it's not the same exact amount every month, then you'd have to do a manual reimbursement for. That's correct.
right.
Right.
And then the second part of that is you're talking about if you don't change your plans, you know, you're okay, you're all set to roll over. If you want to change them, go to you and they have to be done before the 7th of December. Is that the deal?
So if you want to do an annual review and you want to make a change, if it's on the Medicare Advantage side, it must be no later than December 7th. On the Medigap side, you can make changes anytime you want, but unless you have a special situation, you will always be subject to pre-existing medical conditions, medical underwriting.
Thank you.
Yep. Let's,
You mentioned earlier about the prescription plans and a needs analysis and submitting a list of prescriptions. Okay, but if you have any medical procedures during the year, your prescriptions are going to change. Does that mean we would have to send in a new prescription list when it changes?
No, so that's a great question, right? So we never predict the future, right? We easily could need new drugs, or we can stop using drugs in the future, right? But so that's why those tiers are in place. So anytime we do a drug analysis, we'll always be at a point in time based upon the drugs you tell us, dosage frequency. Then should you have additional drugs, depending upon what tier the carrier puts it in its formulary, then you'll know what your copay is. Does that make sense? Yeah, okay. Yes, sir.
Bill, thanks very much for
Yeah.
clarifying things for us. It really helps.
Oh, sure. Is it helpful?
Very much.
I hope so, yeah.
There's also a thing called star ratings, I've noticed, that are printed in the newspaper. You can look them up on Medicare.gov. Should something like that trump how much money we want to spend on a plan?
Ooh, that's a very juicy question. So star ratings apply only to the Medicare Advantage side, right? So CMS does rate real health plans. Medigap side is just financial insurance, right? So there's no ratings on those. But they do rate the Medicare Advantage side. We typically will represent, the overwhelming Medicare Advantage plans that we represent on our exchange are 3- and 4-star plans, which are really good quality plans. If it's 2.5 or less, they're considered an underperforming plan. We may have 1 or 2, but we like to weed them out as soon as we find out that they're 2.5 or below, those kind of things. And then there's currently in the country 8 5-star plans. If you get there's not one here in Florida, I don't believe. A 5-star plan is just an absolutely spectacular plan. But your question is, should that supersede the premium, right? It's a very subjective question. I mean, that's going to be up to you. The premium, so on the Medicare Advantage side, you're going to be paying 0 to low premiums anyway. So you're probably going to weigh more the star rating, right? But between a 3 and 4, there's probably going to be not as much difference. So really what you want to do is if you're looking Medicare Advantage, so the way I would answer is, if you're looking at Medicare Advantage side, you're already in the low premium area, so the premium dollar amount per month is not going to be that huge of a consideration. I probably consider more, is my doctor in the network? Is my hospital that I like to go to in the network, right? Because you're going to, even with a PPO where you can go out of network, you're going to pay more if you go out of network than if you're in, right? So if your doctor, because overwhelmingly, 96% of retirees want to be able to see their same doctors, right? So that's a real consideration. Is that doctor in my network of the plan that I'm choosing? And the benefit advisor will check for you. So if that's a need, when you call and say, you know, because they're going to probe, right? They're going to say, what are your needs? Identify. One of my needs is I got to be able to see Dr. Johnson. I got to go to XYZ hospital. They're going to write that down and they will look and find out for you. They may even put you on hold and call that doctor and say, hey, I've got a retiree who wants this Medicare Advantage plan. Do you participate? And they'll get a verbal yes from that person's admin person. I would consider those things more. Plan D does have prescription drugs. They do have star ratings as well too. Yes. Yes. Yes.
Bill, I have two questions. The first is in October.
Where's the mic? Oh, there you go. Okay. I couldn't hear.
First question is, in October, I received 2 letters from IBM.
Okay.
One said I must enroll, and the other says I don't. What's the case?
What do you currently have today?
I have a Medigap plan.
Medigap plan?
Yeah.
Okay, so so you went off, and so you transitioned over last year.
Yes.
So then you're okay. You're not part of that Aetna crowd that was grandfathered. So you're on this Medigap plan F?
Yep.
So as long as you like F, just stay, don't do anything. But I would still call in just for an annual review. It's free. They'll tell you, are you on your best F and that kind of thing.
Right. Next question is, you mentioned that we should select a Medigap plan based upon its price. If it's plan F, pick the lowest price. That's assuming your doctor will accept any carrier, does it not?
Okay, so don't forget, on the Medigap side, no network. Any doctor or hospital that takes Medicare, you're good.
So they'll accept any carrier.
Any doctor or any hospital that accepts Medicare will take a Medigap plan.
Okay.
Yes, because all Medigaps are financial insurance being secondary payers to original Medicare. So if your doctor takes original Medicare, your doctor will take Medigap regardless of brand. Not the case for Medicare Advantage, right? It's just an apple and an orange. Yeah.
Name's Irwin.
Hi.
On the donut, you said 2680, right? Is the price?
I think 2690.
2690.
Yeah.
Now, does that include the cost out of your pocket for the
Or 2660.
prescription plus the cost that the
Total cost, yes.
Now, what does total cost mean? What you're paying plus what the insurance company's paying?
Yes.
So it's both.
Total retail costs. Yeah.
Thank you.
So unfortunately, and once again, this is the way the government created it. You get into the donut hole faster. You get out of the donut hole not as easy. But so the good news about the Affordable Care Act is that it does shrink the donut hole between now and 2020, so that by 2020 it sets at a 25% level. That is one thing I can say about the Affordable Care Act. The Affordable Care Act does provision that the donut hole will shrink between now and 2020 until it sets at 25% of the drug cost. So when you get to 2020, you no longer have a donut hole, you're just paying 25% of your drug costs. That's provision in the Affordable Care Act.
What's the downside of not having a plan if the cost of your drugs is less than the plan?
And you're probably talking about drug plans now, right?
Right.
Okay, so The downside, so right, so there are people who are, and God bless you, there are people who are really healthy and don't need drugs, right? Why do I even bother getting a drug plan, right? That's kind of your question. The downside is the existence of a late enrollment penalty to Part D should you not have one and you could have had one. Okay, so the late penalty is 1% of the national base beneficiary premium times the number of months that you could have had a Part D plan but didn't get one, and it's for the rest of your life. If you select then it's 1% of the national base beneficiary premium times 12 months that you didn't have it for the rest of your life. So it depends, right? So again, I don't want it to, so the national base beneficiary premium just went up a little bit between this year and next year. It's going to be right around $33 and change. So 1% of $33 times the number of months, but for the rest of your life, you're paying that penalty. So it's a numbers thing that you have to analyze, and the benefit advisor can help you analyze.
My name is Jim again.
Where are you?
I'm
oh,
over
there you
here.
go. Okay, yes, sir.
The dental, I want to get off Medicare for a second. The dental plan. I had a dental plan through the exchange this year.
Which
And,
one? Delta Dental or Humana
yeah,
Dental?
I think it's Delta.
Yep.
I didn't like it.
Okay.
So I want to change. I actually called them and canceled it for the end of the year. So at the end of the year, it'll be canceled. Now, when I go through the exchange and I go to MetLife, for instance, do I have to remove the Delta on the exchange also?
If you've directly canceled it from Delta, we'll know. So you don't have to do it twice, right?
Because it's still showing on the exchange right now.
Well, it'll show through December 31st for sure.
Oh, okay.
Yeah.
So all I need to do then is just sign up then for
something else
for the MetLife.
Yeah.
On the exchange.
Yeah. So you currently have a Medigap?
Yeah, I have Medigap,
Okay.
and it'll just renew itself, right?
Yeah, because Medicare Advantage, you would get dental as bundled in coverage.
Yeah.
So, but you're fine. Yeah.
Yeah,
So so dental is just ancillary. You
Yeah,
can do whatever
as
you want
a
for
general
dental.
question, then the Medigap will renew. My vision will renew itself
If you don't do anything, yes.
if I don't do anything. And so all I need to do then is sign up for the dental.
For new dental, and then if you want to keep your drug plan, you could just keep
I've
that
had the drug
too.
plan since before the exchange, so it's the same one.
Okay.
So all I need to do is
Yeah.
sign up.
Okay.
Does that mean I have to have an appointment and all that?
You can call in and take a chance, but we're right in the thick of our busiest season, so you'll have much more peace of mind in terms of less wait time if you make an appointment. If you don't mind waiting, you can always just call in without an appointment for sure.
But
And
I
then it's
can't
just
do
the
it on-
first
I can't-
available
I can't
license.
do it on the website. I have to actually call in.
You can do everything up to, like Amazon, putting it in a cart, but then a licensed health insurance agent must enroll you.
Okay,
thank you. Yeah. I would also suggest, sir, that it doesn't hurt to do a drug analysis, because even though you love your current, drug plan, there may be drug plans that are better, and you won't know that if you don't do the analysis. Okay, all right, up to you. Where's the mic?
Hello.
Yes, ma'am.
You keep talking about Aetna grandfathered.
Yes.
Is that what the Aetna was before they went into this whole thing? And when I called into this, they told me that they didn't have it.
So some of you, right? So again, I don't know specifically your case. When you call in, they would know they would pull up your profile, but.
I asked for Aetna.
Right, so there's,
We don't have it.
right, so there's certain populations that have the Aetna Medicare Plan PPO and the Aetna Medicare Plan HMO. I believe it's called the Retiree Health Access Aetna Medicare Plan HMO and PPO. But again, when you call in, they would look at your profile and see what you have. But those are the only two that are grandfathered.
Oh, because it was A and B or something. There
So
were no
A and B is
deductibles.
original Medicare. That has nothing to do.
No, not Aetna, A and B. And they didn't have any deductibles anywhere, except they didn't have drug coverage.
Right, so I have no idea what that is if we don't represent it.
Saying grandfathered, and when I called in, I wanted.
You're grandfathered on those specific ones that IBM said you are grandfathered on.
That was what I had in 2013.
Right, so again, we're only following IBM's rules. IBM has only grandfathered those two specific Aetna plans.
Bill, this is Joe.
Hi, Joe.
Just a couple comments on the One Exchange activity. We did not get a mailing at our house other than a very brief flyer. So if there was mailings going out, it's very late. And the second is I tried calling last week to schedule an appointment, and the earliest appointment was sometime in January. So that's totally unacceptable.
No, right,
from a
so I
service
would
standpoint.
say, if you definitely need to make changes, just tell them you need a date before December 7th.
The person I talked to said, just call in and party puts us in the queue for whatever wait time it is, but
No, you can definitely say, I want an appointment before December 7th. And you can actually speak to a supervisor and then you can make that happen. You can definitely do that if you would like to. I appreciate that comment, though. I will take that back and let people know.
Just one comment on the Aetna plan.
Yes.
Aetna has dropped, let me rephrase that. The Boca Hospital has dropped Aetna. And also, anybody that goes to a Boca Care is not accepting Aetna for next year. In fact, I think it went into effect this month.
Last year when I signed up, I went to level 1 like everyone else. And
What does level 1 mean?
Level 1 means the person that supposedly helps you decide what plans you're going to take before they turn you over to the second.
Oh, you went to a benefit advisor, okay.
Yeah,
'Cause
benefit advisor.
we don't use level 1. So
And that, oh, I'm sorry.
That's okay,
But that advisor seemed to me during our conversation, trying to move me through and on to the next person. I ended up with AARP, United Health, but I felt that gal helped steer me that way. And I see on the list, there's a whole bunch of more carriers. So I want to go through these carriers and see what better numbers I can get, but I don't want to be steered.
Right, so did you pick a Medigap or a Medicare Advantage?
Medigap.
All right.
I guess my question is, really, it would be my second question. Even though these people don't get a bonus or anything else for their work, are they timed?
No.
Okay.
They're not timed. But so if she's doing her job, right, and she sees a plan F, that's 328, a plan F that's 447, and a plan F that's 400, why waste your time on the 400 and 447 when she's going to go right to, when she knows you want the 328?
Okay, I
That's
guess
part of it.
I want to ask
Yeah.
that type of question.
Yeah.
Okay.
Right. So you see right here a clear example for your zip code and county. So rates are zip code and county based, right? There's such a huge range for Plan Fs. If I've got a 328 Plan F, why waste your time on a 447 Plan F? Why would you ever want a 447 Plan F? We'll enroll you, and so actually I got to take this back. We'll enroll you with whatever you want. So I've had situations where they said, you know what, I just love carrier ABC. I want carrier ABC. They will, because all calls are recorded, they will say, okay, Mrs. Smith, you do know that carrier XYZ is $50 less, right? But you are telling me that you want to enroll in this plan that's $50 more. If you say yes, we'll enroll you in that plan. You can enroll in whatever you want, but we're going to do our job and try and save you money. Where's the mic? Oh, yes.
I'm a little confused on this $104.90.
Yes.
I'm in a Humana PPO.
Yes.
Where do I come in with that number? I don't
Okay, great
understand what it
question.
means.
So the 104.90 is currently the Part B premium, right? So there's a Part A, there's actually is a Part A premium. Most of you have premium-free Part A. If you've worked 40 quarters or 10 years, you've actually paid for your Part A. Do you remember on your paychecks, there used to be something called FICA tax? That was actually you paying for your Part A. Nowadays, they save effort. They just say Medicare tax, but it used to be called FICA tax. So if you work 10 years or more, you had premium-free Part A. If you work less than 40 quarters, you actually have to pay a Part A premium. Part B is the 104.90. That's every month, automatically deducted out of your Social Security check. Regardless of what supplemental Medicare you choose, Medigap or Medicare Advantage, you must continue to pay Part B. That's an ante to play. So you must always continue to have your A and B.
So that's how my program is funded, basically.
That's how your Medicare is funded.
Yeah.
Yes.
Thank you.
Yes, you're welcome. I think there's a question all the way back there. Thank you.
You mentioned the 328 medical and a 21 PDP.
This is just one example, right?
What is that based on?
This is based on an actual plan for 2015 that I found on the website doing a search for this zip code, this county.
Right?
I'm sorry?
That will vary.
Absolutely will vary. There's a range. So your range is right here, right? There is a range for Medigaps. There's 136 to 447. For drugs, there's 16 to 172. That's your range for Palm Beach County. Rates are zip code and county specific.
You say it's 16? But
I'm sorry?
I'm paying $12.60. Does that mean it's going to go up?
For next year, the lowest prescription drug plan is $16 a month in your county.
Thanks.
How we doing? Oh, we're almost wrapping up here. 10 more minutes, a few more questions. We'll get the mic over.
Yeah, I have Humana drug plan,
Yes?
cheapest one. So does the
So
donor-
this year, right? This year,
Yeah.
the cheapest one is the Humana Walmart prescription drug
correct.
plan. Yes.
So does that donor rule applies for that program?
Donut hole applies for every single Medicare drug plan.
Okay, thank you.
Yes.
Bill, on the 104.90, since
Yes.
I didn't know about that, am I just out of luck for what I've done for this year, or is there some way I can file and get it for what I've already
You can
paid?
still file for this year. You have until June of next year to file for this year's stuff, as long as you still have available HRA dollars. You would probably, if you want to get everything owed, you'd probably want to fill out a separate form just claiming like 11 months worth all in one shot, or wait till next month and claim all 12 months in one shot as a lump sum. As long as you have available HRA dollars, you can do that. HRA dollars. Right. So just call into the service center. They can help you. Yes, sir.
Can a retiree and spouse sign up for two different programs?
Yeah, absolutely. So that's a great question, right? So the thing to know, in the Medicare world, everything is individual. So Mr. Smith chooses a plan for his specific health and drug needs. Mrs. Smith chooses a plan for her specific health and drug needs. Could be different carriers, could be different plans. You now actually have the ability to right-size your coverage. You don't have to over-insure.
Bill, on the HRA, I just got a form in the mail for the non-spousal thing.
Non-spousal election form,
Do I have
yeah.
to do that every year? I did that last year.
You have the, you don't have to, you have the ability to if you want to make changes every year.
Well, I got the form and I
Yeah.
said, oh, it looks like I have to do it every year.
Yeah.
Okay,
So,
thanks.
Yeah. But once you, if you fill out that form, it'll presume you want that unless you change. Yeah. Yes. Are you doing it for your first time? You did it last year too? Okay, so they're probably asking you to do it every year just to give you the chance to change and come out. Right. Right. Well, where's the mic? Oh, okay, you're taking the mic for it.
No, I'm not taking it. I'm just, excuse me, I'm just getting ready if the questions are all satisfied.
Okay, did you have one last question or? Yeah. Yeah, dental plans are not Medicare plans. So as long as you enrolled in a medical through us or a drug plan. Oh, what do you currently have? Is your medical? Okay, so then you have no HRA from us. Right. So as long as you don't want the HRA, then you're set. You can go off on your own. Yeah. Yeah. Is that it? All right. Thank you for coming. I hope it was helpful.
Thanks, Bill. I really appreciate it. Just a couple of things. A few people have asked about the slides. Can you send me a deck of these slides?
So once again, all this information is already at the website, just repackaged differently. So
Okay.
there's no need to send you slides.
Okay.
It's already available right here.
Medicare, One Exchange.
.com/IBM. Right. You need to be visiting the site because what we do is any new information we put at the website. So that's your first place to get the latest information.
Okay, just as a note, can we kind of keep it down here for a minute while I do some administrative stuff, and then we can break for lunch and do the next session? The remote broadcast, for the people that are on remote broadcast, some of the questions have come through that. The answer is go to the website and get the information. The second piece for the remote,
or they get fees.
can we kind of keep it down for a minute? Just a few more minutes.
For writing or a combination of both.
We get our revenues.
Just a few more. The information will be on the website. We will take this video that we have been doing of this meeting and the next meeting, and we will place this on the website, on the IBM internal website. You'll be able to see this and go over it in the granularity that you want to. The second piece is we had a little bit of technical difficulty in the beginning with the remote users. We resolved that. The server, I'm sorry, just about a brain cramp. The router just got reset right after we started, and now it's functioning just fine. So the rest of the broadcast should be just fine. We have a live one sitting here in front on the front row. I've been monitoring it outside. It's been going pretty well. Okay, 1 o'clock is when the next session starts. That's with Cy. In the meantime, we brought out some sandwiches for you if you want to stay. Help yourself. We'll see you back here in about an hour.
Not really.